6-minute walk test. The 6-minute walk test is a useful measure of functional capacity targeted at people with at least moderately severe impairment. The test has been widely used for evaluation and for measuring the response to therapeutic interventions for pulmonary and cardiac disease. The 6-minute walk test evaluates the global response of all the systems involved during exercise, including the pulmonary and cardiovascular systems, systematic circulation, peripheral circulation, blood, neuromuscular units, and muscular metabolism.
The 6-minute walk test is a practical, simple test that requires a 100-foot hallway but no exercise equipment or advanced training for technicians. Walking is an activity performed daily by all but the most severely impaired patients. The test measures the distance that a patient can walk on a flat, hard surface in a period of 6 minutes.
The 6-minute walk test does not determine peak oxygen uptake, diagnose the cause of dyspnea or exertion, or evaluate the cause of mechanisms of exercise limitation. The information provided by a 6-minute walk test should be considered complementary to cardiopulmonary exercise testing, not a replacement for it. Reasons for immediately stopping a 6-minute walk test include the following: chest pain, intolerable dyspnea, leg cramps, staggering or stumbling, pale or ashenous appearance, and diaphoresis.
Safety for the 6-minute walk test. Testing should be performed in a location where rapid and appropriate responses for emergency personnel is readily available. Supplies that must be available include oxygen, sublingual nitroglycerin, aspirin, and albuterol. A telephone and other means of contact for emergency help is required. The technician should also be trained in CPR and basic life support as administered through the American Heart Health Association. Physicians are not required to be present during all the tests. If a patient is on chronic oxygen therapy, oxygen should be given at their standard rate or as directed by a physician on standard protocol.
A few items you're going to need for equipment is a timer or stopwatch, mechanical lap or counter, the table to put all your items, 2 small cones to be walking around as your turn points, a chair that can be easily moved along with the course, preferably on wheels, worksheets on a clipboard, a source of oxygen, blood pressure and blood pressure cuffs, a telephone, and automated electronic defibrillator.
Participant preparation for the 6-minute walk test includes: 1. The participant should wear comfortable clothing. 2. Appropriate shoes for the walking test. 3. Patients should use usual walking aids during the test. Example is if they use a cane. 4. The patient's usual medical regime should be continued. 5. A light meal is acceptable before an early morning or afternoon test. And 6. Patients should not have exercised vigorously within the past 2 hours before beginning the test.
A few measurements. Repeat testing, if you're going to be performing it the same day, should be at the same time of the day to minimize variability. A warm-up for this test should not be performed. The patient should sit in a rest chair located near the starting position for at least starting before 10 minutes before the test. During this time, check the contraindications, measure pulse, blood pressure, and make sure that clothing and shoes are appropriate for test. The pulse oximetry is optional if it is performed, measured, and recorded baseline heart rate and oxygen saturation. Have the patient stand and rate their baseline dyspnea, overall fatigue using the Borg scale. Set the lap counter to 0 and the timer to 6 minutes. Assemble all necessary equipment such as your counter for the laps, time, clipboard, Borg scale, and worksheet, and move the starting point. Position the patient at the starting line. You should also stand near the starting line during the test. Do not walk with the patient because this can affect their pace. As soon as the patient starts to walk, start the timer. Watch the patient, do not get distracted, and lose count of reps. Each time the participant returns to the starting line, click the lap counter once to record.
Post-test, record the post-walk Borg dyspnea and fatigue levels and ask what, if anything, kept you from walking further. If using a pulse oximeter, measure SpO2 levels and the pulse rate based on the pulse oximeter and then remove sensor. Record the number of laps a participant was able to achieve. Record the additional distance covered via the tape markings on the wall and add into the total distance traveled. And congratulate the patient on good effort and offer a drink of water.
Interpretations. Most 6-minute walk tests will be done before and after intervention, and the primary question to be answered after both tests have been completed is whether the patient has experienced a clinical significant improvements measured by an increase in the distance covered in the allotted time.
All references and all material enclosed are retrieved from the official statement of the American Thoracic Society approved by the ATS Board of Directors in March 2002. Okay, the equipment you're going to have available is a stethoscope, a telephone for emergency purposes, the appendix from the official statement, a stopwatch, a mechanical lap counter, and a blood pressure cuff. And a movable chair readily available in case the patient needs to stop or sit at any time during the test.
About 122 over 84. All right, so far right now we have set up, it's supposed to be as recommendations 3 meters every marked for the tape. We did 5 feet every tape line just for the easiness of the test. Our patient has currently rested for 10 minutes and we're getting ready to start here. Just make sure when you do your test, it needs to be a hard, flat surface, and you need to have measurements going both ways. So regardless which way they finish, you have a measurement.
You will instruct the patient as follows. The object of this test is to walk as far as possible in 6 minutes. You are permitted to slow down or stop at any time if necessary. You will be walking back and forth around cones, and you should pivot briskly to decrease any wasted motion. Demonstrate by walking 1 lap yourself, and then walk and pivot briskly around the cone. Remember, the object is to walk as far as possible without running or jogging.
We're gonna get a resting baseline board, 0 being the easiest thing, nothing, no pain at all, 10 being the hardest thing you've ever done in your life. You couldn't take another step at all. We're gonna ask your baseline right now. How you feeling?
0.
Okay. Ready? Go.
Look for distance, heart rate, we did blood pressure.
No. And stop. Record distance, laps, and then you will add any additional feet covered. As in this, it'll be the last lap plus 10 feet heading in this direction.
And how you feeling on the Borg scale after your 6-minute walk test?
2.